I feel like it's been a while since we talked about OCD, so let's do it. So OCD in general is going to involve obsessions and compulsions, those two factors. Obsessions are these persistent, unwanted, intrusive, usually upsetting thoughts that kind of pop into your head over and over again that cause you some sort of anxiety or distress. And then compulsions are typically the way that people with OCD try to deal with the obsessions. And as we'll talk about later, this ends up backfiring and actually propagates the OCD, makes it continue. But the intention behind performing compulsions for someone with OCD is you're trying to get rid of some of the anxiety or neutralize some of the obsessions that are coming on because they're really upsetting. There are so many different types of obsessions. There are as many different types of obsessions as there are human beings, right? Because literally anything can become an obsession. All that you have to have in order to develop an obsession is something that you're worried about and something that pops into your head. And basically people get stuck on these different thoughts that are upsetting to them, and trying to get rid of those thoughts, focusing on them, doing these compulsions, that sort of cements them in your brain and has them continue to come up. Let me give you a list though of like some of the most common obsessions that I see. Number one are obsessions about harming someone. So usually when you have obsessions, they're going to be things that we call like ego dystonic, which means they are things that you wouldn't normally want to do. They're things that are upsetting to you for that very reason. Usually they'll go against your character or some part of your identity that you feel very strongly about. So it makes sense that number one would be fears about harming someone. And it's usually fears about harming someone that you love, someone who would be unable to fight back, like a child or an elderly person or a pet, something like that. Those obsessions tend to come on pretty strongly because that's a really terrible, awful, icky thought. Sexual obsessions are also extremely common. So people worry a lot about whether, maybe they'll do something that's sexually inappropriate, have thoughts that are sexually inappropriate, or maybe think about whether they've done something sexually inappropriate in the past, such as, maybe touch someone in an inappropriate way and not realized it, something like that. Fears of dirt or disease or contamination of some sort are also a very common OCD obsession. People worry a lot about potential health issues, like, what if this headache is a brain cancer or something like that. They also might worry that they're going to get a certain disease from being out in public or touching something that they shouldn't have or not having their house clean. There are so many other possible obsessions. If you guys want to talk more about them, let me know and we will.